Good evening. Thank you all for coming. My name is Riddhi Shah. I'm a dermatologist with Lakeland. I work at Stonegate Dermatology, kind of on the corner of Maiden Lane and Hollywood in St. Joe. I'm going to be discussing part one of a series of topics called Maintaining a Youthful Appearance. We're going to talk about adult acne today, combating wrinkles and the aging process, as well as the new procedure that recently emerged called microneedling. I have no disclosures. The evaluation of beauty. As Nancy Etkoff once said, beauty is a universal component of the human experience. It promotes pleasure, rivets attention, and impels action that helps ensure survival of our genes. More simply put, humans have been preoccupied with beauty since the beginning of time. Now, what exactly defines beauty? Who is beautiful? It's probably hard to describe that into words, but take these three actresses, for example. We would probably all say they're beautiful, and many of them actually have been named the most beautiful woman in the world. Now, it's interesting because there's an Indian actress there. Oh, sorry, wrong button. There's an American actress, and then there is an actress of Asian origin. And despite the fact that they're of different ethnicities, you can see that they have overlapping similarities, and it's these similarities that make them beautiful. So perhaps beauty is less of an art and more of a science than we think. So indeed, beauty is more of a mathematical formulation. So you can see in this image that the face, or the ideal face, I should say rather, is divided into three equal parts. The first part is from the frontal hairline to kind of the tip of the nose, the eyebrow. The second part is from the eyebrow to the tip of the nose, and the last part is from the nose to the chin. This was actually proposed by Leonardo da Vinci. It's called the neoclassical canons. The Greeks have also defined beauty as a mathematical formulation, something called the pi mask. So they actually take a ratio and they divide the face into what are called golden triangles and hexagons to illustrate what is the ideal human face. So I really love this image. It's actually of a daughter and a mother side by side, kind of merged or blended together. And you can see that with the normal aging process, what happens is that there's a shift in these neoclassical canons as well as that golden ratio or rule. You can see that the upper third of the face starts to elongate because there's a recession of the frontal hairline, as well as ptosis of the brow because of eyelid laxity. There's kind of elongation of the nasal tip, and then the lower third of the face becomes shortened because of bony resorption as well as fat redistribution. You can kind of see here that the frontal hairline is a little bit stretched. There's kind of a widening of the eye and kind of loose skin on the upper and lower eyelid. And you can see there's a loss of definition of the contour of the jawline. So what makes someone look youthful? So you can see again that same mother and daughter. So the things that make you youthful are these high, full cheekbones, kind of these full lips, as well as kind of a sharp definition of the jaw. And what happens is that this triangle, over time, gets flipped or inverted. So what's going on underneath the surface of the skin that's contributing to the facial aging process? So the skin is very important. The main things to pay attention to are the collagen and elastin in the skin. In addition, underneath the surface, there are fat pads, muscles, bones, and even your oil glands that play an important role. So collagen is a major protein that's found in our body. It's found in not only your skin, but your muscles, your bones, your tendons. It can even be found in the digestive system. So this is the protein that gives our skin its strength and also makes our skin look youthful, hydrated, supple. Elastin is also a major protein in the body, and this is the protein that helps our skin kind of bounce back to its original position after it's been stretched or pinched or whatnot. So what happens in the body is that naturally as we age, your collagen and your elastin are going to slow down in production. And so this is what causes wrinkles as well as sagging of the skin. So normally when we hear the word fat, we probably all get a little bit scared. But actually fat in the face is a good thing. And your skin in the face and the fat is not actually one confluent layer. It's made of many distinct compartments which are known as the facial fat pads. What happens when we get older is that these fat pads actually get thinner and then they start to descend or drop. And so you can see in this image that process causes that hollowing of the eyes as well as the flattening of the cheeks. It also causes kind of a sunken appearance around the mouth and the lips, and again that sagging of the jawline and the appearance of the double chin. So underneath the fat we have muscle. So muscle actually contributes to the formation of wrinkles. So it's the repetitive muscle movement that we make every day. So we all smile, we laugh, we talk, and it's because of those that we get laugh lines, we get frown lines, we get crow's feet around the eyes. In addition, as we all get older, there's a loss of muscle tone. And so again, that can cause sagging as well as loss of that definition and contour. So the other dreaded word would probably be wrinkles. We're all probably afraid of getting wrinkles, but unfortunately it is inevitable. So wrinkles are kind of also divided into a couple of groups. There's static wrinkles and dynamic wrinkles. So dynamic wrinkles are the ones that only appear when you're actually contracting that muscle, so when you're smiling or frowning, for example. What happens over time is that once you repetitively contract that muscle, that wrinkle actually becomes permanently ingrained in your skin, and that's what's known as a static wrinkle. And this is a wrinkle that occurs without any muscle contraction. Wrinkles also can be divided into 4 types. So you can see type 1 here is a younger individual, probably in their 20s. They need minimal makeup and they have maybe a few static wrinkles but relatively smooth, supple skin. Type 2 is when you start getting the development of mostly static but maybe a few dynamic wrinkles, usually starting around the mouth and around the eyes. And that gets more prominent with type 3 wrinkles. And then type 4 is when you have majority of just static wrinkles that cannot be unchanged. So we probably all talk about bone loss on a day-to-day basis, but when we think about bone loss, we're probably worried about breaking our hip or breaking our backbone, but actually you have bones in your face that you should be concerned about as well. So just like your bones in your arms and leg get weaker and resorb over time, so do the bones in the face. And again, that's what causes kind of that sunken appearance around the eyes, that decreased sharpness of the angle of the jaw, that lowering of the brow, as well as kind of protrusion of your chin. Okay. So this is an image of what's called the pilosebaceous unit, which is where your oil glands kind of originate from. Your oil glands are also known as your sebaceous glands. So normally when we think of oily skin, we think of it as a negative, but actually it can be a positive to a certain extent because when you're younger, you produce more oil in your skin, and that's what gives your skin that kind of moisture, glow appearance on a day-to-day basis. What happens when you get older is that your oil glands start to atrophy and that oil production is decreased and your skin tends to look more dry. I'm going to kind of shift gears for a second here, just because we're on the topic of oil glands, to talk about adult acne, because the oil glands play a major role in its development. So, adult acne. I think most of us hope and wish that once we're done with the teenage years that we'll never get acne again. Unfortunately, I see patients, in their 20s, 30s, 40s, and even 50s with acne on a daily basis. Now, what's causing the adult acne? Usually it's very hormonally mediated. So you actually have two categories of hormones. You have your androgens, which are mostly your male hormones like testosterone, and then you have your estrogens, which are your female hormone. But women actually produce androgens just like men do. And it's that androgen production that can cause the acne. So what happens is that, as you can see in this image, with that pilosebaceous unit, androgens actually cause your oil glands to make sebum, and that causes a blockage. It accumulates in this unit, and then there's a blockage or an obstruction kind of at the top of the unit, forming that primary lesion called the comedone, or the blackhead or whitehead, as you can see in this image. In addition, there's a bacteria that's normally on our skin that tends to overgrow, causing inflammation or inflammatory acne. So who gets adult acne? So it's usually individuals that have a hormone imbalance. So it's women that have high androgen levels. One thing to keep in mind is that these levels are high, but they're still within normal limits. So it's not anything pathological that you have to worry about. Also, there's an increased sensitivity of your oil glands to these increased androgens, and there's also a drop in estrogen. So estrogen actually plays a protective role. It suppresses sebum production. It also directly suppresses androgen production. Normally, hormonally mediated acne is the acne that occurs kind of along the jawline and the chin. So how do we treat hormonally mediated or adult acne? So the best is kind of a combination of both oral agents as well as topical agents. The two most common oral agents that are prescribed are oral contraceptives and spironolactone. And keep in mind, it is recommended to be on them for at least 3 to 6 months to kind of see if they're efficacious. So how do oral contraceptives work? They work directly by inhibiting that androgen production that we talked about, reducing free androgen levels, and they directly work on blocking androgen activity at the level of your oil glands. However, not all oral contraceptives are made equally. So most of them have a combination of what is called estrogen and progesterone. The estrogen, like we said, is protective, so that's always good. But the progesterone, there's actually progesterone that's anti-androgen, which means it can help combat acne, and then most of the progesterones can actually make acne worse. So there's only 3 that have been FDA approved, which are Estrostep, orthotricycline, and Yaz in the treatment of acne. Something to also keep in mind if you're on a progesterone-only agent, so common ones are like Depo-Provera, which is the injection. There's also a couple of IUDs and implants that are progesterone only. Those actually may cause you to get more acne or even cause acne if you didn't have it before. So spironolactone, this may be a medication that you're not familiar with. It's actually normally used as a blood pressure medication. It's a water pill, but it actually has anti-androgen properties to it. So it works by, again, blocking those androgen receptors. It blocks androgen synthesis, and it also decreases sebum production. The best thing to do is actually to use the oral contraceptives with the spironolactone together with what are called topical retinoids to have the greatest results. So topical retinoids. So these you're probably familiar with. It's like Retin-A or tretinoin. These work by inhibiting inflammatory biomarkers. They're also called comedolatic agents. So basically they prevent your skin cells from adhering to one another, preventing that production of the comedone in acne. And they also normalize follicular keratinization. So retinoids come in different types and different strengths. Some of these you may have heard of. So adapalene, the more common name for it is Differin. The 0.1% actually recently became available over the counter, but it's available in 0.1 and 0.3% as a cream, a lotion as a gel. The nice thing about this agent is it tends to cause less redness and drying compared to the other agents, and it's the only one that is photostable, which means you can use it day or night. Tretinoin is a very common one. And this one is kind of the mainstay of both mild to moderate acne. And the nice thing is this can actually be used not only for acne, but for fine lines, wrinkles, and stretch marks. And the last one, tazarotene, or more commonly known as Tazorac, can be used for more severe kind of cystic scarring acne. One thing to keep in mind is that all of these medications are unsafe if you're pregnant or nursing. So the next condition is another type of adult acne. It's got a fun name to it. It's called Favre-Rocochat disease. I'm not quite sure who named that, but this is actually acne in the elderly. So it's individuals, both men and women, because of sun exposure as well as smoking history, that get kind of these cysts or blackheads right around the eyes, temples, and cheeks most commonly, and usually there's kind of a background of more weathered, nodular appearing skin. So I really like this image here because this is an image of a woman that worked in an office, and you can see that on the left side of her face, it was always looking at a window, and because of the UV exposure, she kind of developed this disease, and she's got cysts on her face and that nodular elastosis, compared to the right side that never had any exposure. So how do you treat Favre-Rocochat? Topical retinoids are often used initially. There's also a procedure called acne surgery where you do what's called comedone extraction. You can get a microderm abrasion, and then the most important thing, of course, is sun protection. Sunscreen, hats, staying out of the sun between 10 and 2. Okay, so we're gonna kind of shift gears back again and talk a little bit about facial aging and then the skin pen. So the skin pen is kind of a new state-of-the-art microneedling device. And so it improves not only the appearance of acne scars, it can improve surgical scars, as well as fine lines and wrinkles. So the skin pen actually looks like a pen. So on the very tip of it are about 14 very finite needles, and they work by creating thousands of kind of precise micro injuries into the dermis of the skin, which is kind of the middle layer of the skin beneath the top of your skin. The needles actually can penetrate in a controlled fashion anywhere from 0.25 to 25 millimeters, depending on the area that's being treated as well as the degree of damage that you're addressing. But the purpose is that it's actually allowing your skin to repair itself by triggering new collagen formation, new elastic tissue formation, but without any scar in the process. So here's actually an image of the skin pen itself, and you can see that there's these very fine needles at the tip. The recommendation is actually to start with 3 treatments about 4 to 6 weeks apart. Usually each treatment may take anywhere from 30 to 45 minutes. And the great thing is there's minimal to no downtime afterwards. So most people, after they've had the treatment, they look like they've had a very mild sunburn. They may have a little bit of redness for about 24 to 48 hours, but it goes away rather quickly. The other great thing is that it occurs you can use it on all skin types. So that's one of the things that a lot of the lasers do not address. And it can be performed at any time of the year, so winter, spring, summer, or fall. And the most important thing is that the results are long-lasting. So unlike some other cosmetic procedures where you may need to go back 6 months or a year later to get a touch-up, here you're stimulating your body to produce collagen and elastin, and it may be 5 years or even longer before you ever need another procedure. So for best results, we actually recommend the skin pen with something called the Skin Infused Kit. So the Skin Infused Kit is actually 6 different products. There's a sunscreen in there, a collagen booster, a vitamin C serum, a hydrating support. So all of these different products have things like vitamin A, vitamin C, vitamin E, different peptides, minerals in it that are going to help reduce that inflammation, as well as, again, help with skin remodeling, collagen synthesis, as well as maintaining the skin kind of homeostasis and moisture. So most importantly, we want to see results, right? So here's an image before and after of a patient that had 6 skin needling procedures. And you can see that she has significant acne scarring. We'd probably call this both kind of boxcar as well as ice pick scarring, both on her cheeks and her forehead. And you can see that the before and afters are quite dramatic. Similarly, these are 2 individuals that had the microneedling done for fine lines and wrinkles. And you can see why we recommend 3 procedures, because this patient had 1 procedure and this patient had 2. And you can see even after just the 2nd procedure, if you take a look at just these wrinkles and folds right around the mouth area, they're dramatically improved after the 2nd procedure. So the reason we recommend both the skin pen and the skin infused kit together is because it's very important to kind of do as much as you can to stimulate that collagen production. So you can see, you know, there's a graph where individuals didn't have anything done. There's one where they had 3 just skin pen done, and then 3 where they had the skin pen with the infused kit, kind of the same thing on this side. And you can see that the collagen gene expression was 433% more, and then the elastin 193% more, and this is actually 3 weeks after the procedure was done. So you can see even well after you've done the procedure, your body is still making new collagen, still making new elastin, kind of still improving the overall tone and texture of your skin. All right. I think that's all I have for you guys today, but I will open the floor for any questions.